Welcome back, everyone. If your teenager said they were tired, feeling a little sick, had some chills, maybe some skin irritations, you might think they had the bug that was going around. I doubt that you would think of kidney failure. Well, meet Miss Cassidy. She's right over here. At age 17, she was diagnosed with kidney failure and ended up having to go through surgery. Today, her mom, Ricky, her sister and donor, Trisha, and her doc, Angela DeRosa, are all here with us. And Cassidy, tell me first of all about these symptoms. What kind of alerted you that you weren't feeling right?
It was just I was tired. That was the only symptom I ever had. Just fatigued, kind of exhausted, and I did work 2 jobs and I was going to high school at the same time, so it
made sense.
I was just tired. I worked all the time, 7 days a week, but
so you went to the doctor a couple times. You guys thought it was mono. Then what made you change docs or go to someone else?
That was actually my mom. She was looking into Dr. DeRosa, and I actually took her appointment that day that she was supposed to see her, but I saw her because I wasn't feeling good.
We didn't know if it could be hormones, you know, because she was 17. And so we had heard high recommendations from Dr. DeRosa. In fact, Trisha was already one of her patients. So went in, and Dr. DeRosa just took a look at her, and she knew. She said,
all right, Dr. DeRosa, back to you.
Yeah.
So what did you see that was so clear to you that other people had passed over?
Well, the interesting thing was she was so swollen. So she came in, her face was swollen, and her arms, her legs. She had a lot of what we call edema, which is swelling of the extremities. And something was not right. And sometimes you can see that with hypothyroidism and some other hormonal issues, which is what I specialize in, but I'm also an internal medicine doctor. I knew that this was something different and immediately did a blood test and urine on her. And that day I called a nephrologist and said, this girl's in kidney failure.
And had been for
Had
some
been
time?
Probably for a couple of years at least.
Oh, so how devastating could that be? What could have happened had she let that go?
Well, I mean, it was interesting. Her course was actually quite rapid. Once we diagnosed her, within 6-7 months, she was already undergoing a kidney transplant. Unfortunately, what would have happened is her blood pressure started to go very, very high. She would have probably ended up having been in the hospital in the ER, and they would have probably found it a few months later because her blood pressure was just spiking, and she would have had consequences from that. But it was pretty quick, pretty devastating, pretty fast.
So we have to bring in the sister, Miss Trisha.
Yeah.
So she stepped up. What happened next, Trisha?
When she got to 20% kidney function, we were able to start the testing, and
You were a
I was a match.
So what did that mean to you? I mean, clearly exciting, but a little scary because it's more risky as a donor to have the surgery.
Yeah, the doctors were fantastic, you know, in giving us the information and educating me on what I would be going through.
And so how was it, and how did that feel to be able to do that for your sister?
So amazing.
We're underselling what she's done. She's a hero, and this is such a remarkable family, and how they all stepped up to take care of her and the way they care for each other. And in my eyes, you're a hero. So.
I see several heroes on this. Looking at me, aren't I lucky? I have a great view. Cassidy, have your sister do this for you?
sorry, what did she say?
To have your sister do this for you?
It meant the world, just because she's a mom herself, and she's her own family to think about, and she was willing to like help me.
You're your sister's baby. That's what you do, right?
Yep.
I mean, you wouldn't have done anything else, would you?
Nope, I never even thought twice about it. You know, I realized, oh my gosh, this is why we have 2 kidneys. And this is why mine are healthy, because she needs one.
Yeah. Okay, so we're all in tears. Let's talk about this event. Where is this event? How can we help? How can we participate? What's happening?
Oh, Dr. DeRosa probably knows more about it than I do.
It's the Arizona Dancing with the Stars. It's really a wonderful organization, 10-year anniversary of the Arizona Kidney Foundation, and they put on this wonderful fun event where they get people like myself who have no dance experience whatsoever, and they partner us with these wonderful professional dancers, and we go out just like the big LA Dancing with the Stars, and we perform on 90
and
seconds.
You're dancing.
I am dancing for this girl right here. It's terrifying.
What are you doing?
I'm doing a paso doble, so really hot and sassy, just like I like my men.
I like this bunch. I'll pay money to come hang out with you guys for a good cause. So hit me up with that website again.
It's AZ Kidney, so it's www.azkidney.org. So azkidney.org, not foundation in there. But it's a wonderful event. You can click on the link for the Dancing with the Stars. and it's next Saturday night at the Westin Kierland. There's going to be 21
we will
dancers.
be there. Thank you so much. Thank you. And thank you, everyone. You guys are awesome. And we'll be right back. Arizona, stay with us.